All right, welcome. Today we're diving into something that could, and I mean genuinely, change your entire shift. We're talking about using AI to turn one of the most time-sucking parts of nursing, care planning, into a process that's fast, high quality, and maybe even enjoyable. Let's get right into it.
So this right here, this is the big promise. It's all about shifting from what feels like a frustrating admin task to a truly powerful tool for patient care. And the key is just moving away from how we've always done things.
Because let's be real for a second, every single nurse knows this struggle. You know, deep down, that a care plan is supposed to be this amazing, detailed, individualized roadmap for your patient. But the reality on the floor? Well, it's a bit different, isn't it?
Oh, you know the drill. You find some generic template, you pop in the patient's name, and then you kind of try to jam it into place. It feels impersonal because, well, it is. It's not really tailored to the unique person you're actually taking care of.
And sometimes, the very technology that's supposed to help just makes it worse. You get these totally useless circular diagnoses from the electronic health record, like this absolute gem: risk for falls related to hospitalization as evidenced by being in hospital. I mean, come on, that doesn't help anyone. It's just noise.
And this is the part that really stings, right? You became a nurse to give amazing, thoughtful care. But when you're forced to use these broken tools, it feels less like professional nursing and a whole lot more like you're just checking a box to satisfy some requirement.
So, what does it actually take to build a proper, individualized care plan from the ground up? Well, the data shows it takes about 50 minutes.
And there it is. That's the fundamental problem on pretty much every unit out there. The answer is, almost nobody has that kind of time. The daily demands of patient care just don't leave room for it. But that's all starting to change.
Okay, so let's get into the good stuff, because this is where things get really exciting. We are not talking about replacing nurses or automating your clinical judgment. Not at all. We're talking about a powerful new assistant that helps you bridge the gap between the amazing care plan you want to write and the one you actually have time for.
Now, the key to unlocking all this is something called a master prompt. Just think of it like a blueprint. It's a structured, professional conversation you have with an AI. You feed it the clinical context, and it helps you build out the framework, making sure that no critical piece gets missed.
And the process itself is so simple, and this is the important part. It keeps you, the clinician, in complete control. You gather your patient's data, fill in the prompt template, the AI generates a draft, and then comes the most critical step of all. You review it, you edit it, and you customize it with your professional judgment. The AI is just the assistant. You are always the expert.
You know, this isn't just about being faster. What's so powerful here is that using a structured prompt it naturally guides you away from all the common mistakes we make in care planning. It forces a higher level of quality right from the get-go.
Just look at this classic before and after. On the left, patient will have less pain. Okay, what does that even mean? It's totally unmeasurable. But the AI-guided version on the right, that's a professional goal. It's specific, it's measurable, it has a timeline, and it's tied directly to a real functional outcome for the patient.
And the same thing goes for interventions. Monitor patient. I mean, that's so vague, it's basically useless. But the AI-guided fix gives you a specific, actionable instruction that any nurse coming on the next shift can follow perfectly. This is how we actually improve continuity of care.
All right, let's keep building on this, because this whole method isn't just for one standard cookie-cutter care plan. No way. This is about creating a versatile, powerful toolkit that you can adapt to pretty much any clinical situation you face day in and day out.
Seriously, you can build an entire library. Need to quickly figure out the priority diagnoses for a new post-op? There's a prompt for that. Need a detailed, evidence-based plan for pain management or fall prevention? Done. You can even create prompts for super specialized areas like ICU, pediatrics, or mental health. So let's talk about the bottom line. What does all of this actually mean for you, on the floor at the end of a grueling 12-hour shift? Well, it really comes down to three things: your time, the quality of your work, and honestly, your own professional satisfaction.
I mean, visually, the impact on your time is it's staggering. On the left, you've got that 50-minute mountain of trying to create a plan from scratch. And on the right, the AI-assisted way. You're going from nearly an hour down to less than 10 minutes. It's a total game changer.
Let's put a hard number on that. 42 minutes. That's 42 minutes you get back, per patient, per care plan. Now, just imagine you have 5 patients. You can do the math, right?
That is a huge amount of time that's reclaimed for actual hands-on care.
And just so we're crystal clear, this is not a trade-off. You are not sacrificing quality to get more speed. You're actually getting the best of both worlds. Your time is drastically reduced, while the quality of your documentation is significantly increased because it's more specific, it's evidence-based, and it's free of those common mistakes. And that really brings us to the final and maybe the most important question of all. With all that time saved, what could you do? Maybe more time for patient education? More time to comfort an anxious family member? More time to mentor a new nurse who's struggling? Or maybe, just maybe, more time to take a deep breath for yourself. That is the real potential here.